Okay, so the today's session will be on the functional anatomy of the adrenal cortex. One thing. Second thing, the adrenal cortical hormones. Okay, among that, the important hormones. Okay, so today I think we only can finish adrenal cortex functional anatomy and one of the hormone and it's applied. Okay, so you must be knowing the adrenal cortex. Okay, adrenal cortex is a structure which is just above the kidneys. So it is also has been called the suprarenal gland. Okay, above the kidneys of suprarenal gland is around the 4 gram is weight each. So you have the two adrenal cortex, right and left, above each kidney. Right kidney, left kidney. Right kidney shape is right kidney is a triangular, left kidney is a crescentic shape, and in the adrenal cortex, the most important in adrenal gland, the most important structure is the adrenal cortex. So adrenal gland, outermost portion, 2/3 portion, you can say that 80% portion is called the adrenal cortex, and inner 20% portion is called adrenal medulla. Both has the role, they secrete the hormones. Adrenal cortex also secrete the hormones. Adrenal medulla also secrete the hormones. Adrenal medullary hormones, you must be knowing that the catecholamines it secrete. Adrenaline, noradrenaline, and dopamine. Okay, you can hear me?
Yes, sir.
Yeah.
Yes,
So,
sir.
Yes, sir.
yeah.
Yes, sir.
Yes, sir.
So in between, if you don't hear me anything there, then please tell me. Okay. Uh, so adrenal cortex also secretes hormone. Adrenal medulla also secretes hormone. On the adrenal medulla secretes the catecholamines, epinephrine, norepinephrine, and dopamine, and that will having the you have the separate lectures on lecture on the adrenal medullary hormones. Okay. Adrenal cortex is 2/3 of the adrenal gland comprised of the adrenal cortex, and that secretes some hormones, and adrenal cortex is essential to the life than the medulla, because whatever the medullary hormones are there, even though you don't have the medulla, that hormones has been secreted by you body take it from the postganglionic sympathetic nerve endings. So that will not the big issue if you don't have the medulla. But if you don't have the adrenal cortex, then it is incompatible to the life. Person cannot survive it. Okay, that's the importance of the adrenal cortex. So adrenal cortex above the kidney, and 2/3 of the adrenal gland is comprised of the cortex. Consists of, now in this lecture, what we see the functional anatomy, then the hormones secreted by the adrenal cortex, and the functions of the hormones secreted, and important applied. Okay, not each and every applied, but if there is adrenal insufficiency is there, that is Addison's disease we will discuss. If there is excess of adrenal cortical hormones, especially glucocorticoids, then there is something called Cushing's syndrome is there. So these two diseases we will discuss it. Okay. Then seeing the layers of the adrenal cortex from outer to inner, it has the 3 layers. Zona glomerulosa, 15% of the outer cortex is formed of zona glomerulosa. Zona fasciculata, 75% of the adrenal cortex. Second layer is consisting of the zona fasciculata. And innermost is called zona reticularis. So you have the 3 layers from outer to inner side, that is zona glomerulosa, zona fasciculata, zona reticularis. Now, okay, now this is the adrenal gland. See, this is, I think, left adrenal gland. It is a crescentic shape, right? I told you this is a triangular shape. So outer one is the cortex, inner one is the medulla, and it is all bounded with a capsule. So zona glomerulosa secretes hormone that is called aldosterone, a mineralocorticoid. Zona fasciculata secretes a hormone which is concerns with the glucose metabolism. That's what is called glucocorticosteroids or glucocorticoids. And zona reticularis, inner one, secretes the hormone that is called adrenal androgens. Okay, they are androgens secreted by the adrenal. That's why they call adrenal androgens. So mineralocorticoids secreted by the zona glomerulosa, and it is largely responsible for the long-term regulation of blood pressure. Okay, it has the effect on distal converted tubule and collecting duct of the kidney, where it causes increased absorption of sodium and increased excretion of both potassium and hydrogen ions. So it is concerns with electrolyte and water maintenance. That's why mineralocorticoid is role is there, and that is one of the reason why adrenal cortex is essential, because it has a role in electrolyte and water balance. In its absence, electrolyte and water balance cannot happen and person may die. Okay, then next is glucocorticoids. Glucocorticoids are produced by the zona fascicular, that is second layer. The called cortisol and corticosterone, in any you called is cortisol or corticosterone is the same name. Okay, and its secretion is regulated by the hormone adrenocorticotropic hormone on the from the anterior pituitary. Both glucocorticoids and mineralocorticoids, their secretion is regulated by the anterior pituitary hormone, that is adrenocorticotropic hormone. So anterior pituitary has a role in controlling their secretion, and anterior pituitary in turn is regulated by corticotropic releasing hormone from the hypothalamus. Okay, and the innermost layer, the androgens, is produced by the zona reticularis. Okay, they are the androgens are dihydrotestosterone, androstenedione, and dihydroepiandrosterone. These are the androgens produced by the adrenal androgens. Okay, and adrenal androgen, what is the role is that these adrenal androgens are responsible for prepubertal changes in both males and females. Prepubertal growth of hairs, that is axillary and pubic hair. It is under the influence of these adrenal androgens. And if adrenal androgens, there is an imbalance in boys, then what will happen if imbalance of the androgen in the boys, that is called precocious puberty, early puberty. If there is imbalance in the females or girls with the adrenal androgens, with the excess adrenal androgens are produced, what will happen? There is hirsutism happens, or there is menstrual irregularity happens in the girls. So that's the importance of adrenal. They are produced in small amount. Okay, they are produced in smaller amount, but they have a certain role in pre-pubertal development in both boys and girls. Okay, so you can hear me?
Yes,
Yes,
sir.
sir.
Yes, sir.
Yeah.
Yes, sir.
Yes,
So
sir.
Yes, sir.
with this basic knowledge, now the see, it is a steroid. Adrenal cortic hormones are, they are all steroid nature, whether it is glucocorticoids, mineralocorticoids, or adrenal androgens. So all the steroid hormones, okay, their main precursor is the cholesterol. Means cholesterol, their cells, adrenal cortical cells, they have the cholesterol, okay, or they take it from the blood. So cholesterol is the main precursor. Cholesterol, they convert it into the pregnenolone. Okay, pregnenolone get converted into progesterone. This progesterone get converted into 11-deoxycorticosterone, get converted into corticosterone and aldosterone. Okay, in this sequence, there are a lot of enzymes in this here: cholesterol, pregnenolone, progesterone, 11-deoxycorticosterone, corticosterone, aldosterone. In this sequence, okay, the important enzymes, your 21 hydroxylase enzyme is one, which convert progesterone to 11-deoxycorticosterone, and 11 beta hydroxylase enzyme, which converts 11-deoxycorticosterone to corticosterone. So remember this; these are two important enzymes, because these asked as the MCQ question. If there is a deficiency on 21B hydroxylase enzyme, what is there? Or there is a deficiency of 11 beta hydroxylase enzyme, what will happen? Okay. So pregnenolone get converted into 11 hydroxy progesterone by 17 alpha hydroxylase enzyme to 17 hydroxy progesterone, and which again get converted under the influence of 21 hydroxylase into 11 deoxycortisol, which get converted into 11 beta hydroxylase to cortisol. So 21 hydroxylase enzymes is a parallelly important. Progesterone to 11 deoxycorticosterone and 17 hydroxy progesterone to 11 deoxycortisol. If there is no 21 hydroxylase, so progesterone cannot get converted to further. 17 hydroxy progesterone cannot get converted into further. So they go into some differentiations. Adrenal androgen synthesis increase. Remember. And 11 beta hydroxylase also runs parallel. 11 beta hydroxylase is responsible for 11 deoxycorticosterone to corticosterone. 11 beta hydroxylase is responsible for 11 deoxycortisol to cortisol. Okay, so 11 beta hydroxylase deficiency is there. So this 11 deoxycorticosterone and 11 deoxycortisol, they cannot get converted into further stages. These are two enzymes, okay, deficiency of which is quite common. So if there is a deficiency, that leads to synthesis of not these stages, but it goes into synthesis of adrenal androgens. More adrenal androgens has been synthesized. Because these get more and more, these things goes into the adrenal androgens, and more adrenal androgens has been synthesized. So prednisolone get converted into 70 hydroxy pregnenolone get converted into 17 hydroxy pregnenolone to dehydroepiandrosterone. Dehydroepiandrosterone get converted into androstenedione. Androstenedione also get come from progesterone 70 hydroxyprogesterone to androstenedione. Androstenedione get converted into testosterone and to dihydroxytestosterone. So adrenal androgens are dihydroepiandrosterone, androstenedione, testosterone, okay, and estrone and estradiols are again synthesized from conversion from androstenedione testosterone by enzyme aromatics. So all these dehydroepiandrosterone, androstenedione, traces of testosterone, dihydrotestosterone, estradiol, estrone, they come under adrenal androgens. Okay, even though they have very small amount of stresses, but their role is important in pre-pubertal changes. Okay, with this functional anatomy, we move further. Can you see this?
Yes,
Yes,
sir.
sir.
Yeah.
Yes, sir.
So we talk with the glucocorticoids. Glucocorticoids is the hormones which is secreted by the second layer, zona fasciculata layer, which accounts for 75% of the out of the three layers: zona reticular, zona glomerulalis, zona fasciculata, zona reticularis. These are three layers. Second layer is zona fasciculata, and it is 75% of the three layers. So it secretes glucocorticoids. Its name got glucocorticoid because glucose and steroids, this and cortex. So this is the hormone secreted by the adrenal cortex, which is steroidal in nature and responsible for glucose metabolism. That's why its name is glucocorticoids. So now it has the role in protein metabolism, fat metabolism, and most importantly, glucose metabolism. Lot of anti-inflammatory actions. Okay, we see this. On the protein metabolism, it increases the protein breakdown. Okay, so what it does, it activates some transaminase and deaminase enzymes in liver, hepatic. So what that enzymes do, transaminase, deaminase enzymes, they convert the amino acids into glucose. So it increases the neoglucogenesis formation. So basically, it try to break down the proteins, try to convert the amino acids, and increasing transaminases and deaminase enzymes try to convert these amino acids into glucose. So basically, glucose amount of glucose is increased in the blood. So on carbohydrate metabolism. So this is steroids are one of the stress hormones, the hormones which are released during stress, apart from growth hormone and your catecholamines released by the adrenal medulla. The glucocorticoid is also one of the stress hormone. Why stress hormone? Because during the stress, when you are in a stress, body is in under the stress, the body requires lot of energy to produce. So to produce lot of energy, body requires raw material in the form of glucose, fatty acids. So glucocorticoids increases the amount of glucose and fatty acids inside the blood to fight against the stress. On carbohydrate metabolism, what is does 6-phosphatase enzyme activities increases in liver. So what it stimulates gluconeogenesis in the liver. And what it does, it prevents peripheral utilization of glucose by inhibiting phosphorylation, means it increases the glucose formation and it decreases the peripheral utilization of glucose. So obviously it increases the blood glucose level. So it is a diabetogenic. Remember, steroids are diabetogenic. Who has the diabetes? So they precipitate ingestion of steroids. They precipitate the diabetes because blood glucose level is increased. It interferes with glucose utilization, and obviously this leads to hyperglycemia. Obviously glucose ज्यादा है तो क्या होगा, increase glycogen synthesis by increasing glycogen synthesis and indirect inhibition of glycolysis. तो glucose ज्यादा होगा तो obviously what it does, glycogen formation बढ़ाएगा liver में, right, and it inhibits the glycolysis in the liver. On fat metabolism, what it does, it increases the lipase activity by potential action of other hormones. Means other hormones has which have the other hormones which increase the lipase activity. There's one of these growth hormones and catecholamines. Okay, so plus glucagon and thyroid hormones. These hormones have the lipase activity, so this enhances their activity. And so what happens? Lipase बढ़ जाएगा तो what happens? Triglycerides are broken down. What free fatty acids has been formed. So it favors mobilization of fatty acids from adipose tissue to liver, where metabolism of fatty acids enhance, which inhibits glycolytic enzymes and increases gluconeogenesis. So it mobilizes the fats. It tries to enhance their breakdown and causes increased breakdown of fatty acids. So excess glucose steroids. So steroids, under the influence of the steroids, fat distribution also is, there is a redistribution of fat over the body. So that's the feature you see it. Then electrolyte and water metabolism. So what it does actually, it increases retention of sodium and excretion of potassium. So how? By increasing synthesis of angiotensinogen, one thing. Okay, angiotensinogen 1 बढ़ जाएगा तो increase secretion of aldosterone, and aldosterone what it does, sodium and retention of sodium and water. Okay, and second thing what it does, it enhances the GFR, one thing, plus it antagonizes the action of antidiuretic. See, these are very two contradictory actions of glucocorticoids. It enhances the glomerular filtration rate of kidney, plus it antagonizes the antidiuretic hormone. So antidiuretic hormone का action को antagonize करेगा, plus it enhances the ADH destruction by the liver. So what will happen? No antidiuretic hormone, GFR is enhanced, means it promotes diuresis. It promotes diuresis means it doesn't allow water to accumulate inside the body. If there is no glucocorticoids or whenever there is adrenal corticoid insufficiency, what will happen? There is a deficient diuretic response, so that water load is not disposed of, and this may lead to water intoxication. And that is one of the importance of these adrenal cortex. Water has been not disposed from the body. There is water intoxication. This water, what it does, it creates hypotonic media. Water enters the brain cell, produces convulsions, unconsciousness, and death. Okay, so that's a problem with water intoxication. So that's why steroids hormone or cortical steroids hormones are very essential for the life. Okay, and out of that, if you have the question came out of mineral corticoids, glucocorticoids, which is very important, this mineral corticoids is very essential for the life. If there is no mineral corticoid, person cannot live it. Then this is very important action. This is something called vascular reactivity. Glucocorticoid sensitizes arterioles to the constrictor action of catecholamines, especially norepinephrine. Okay, norepinephrine is released by the postganglionic sympathetic nerve endings. So what will happen in the presence of glucocorticoids? The action of catecholamines is enhanced. Okay, glucocorticoids inhibit, on the contrary, COMT means catecholamine transferase. This is the enzyme which causes breakdown of catecholamines. Okay, this is second thing. It enhances the catecholamine synthesis by its activation of epinephrine. It forming enzymes like phenylethanolamalane N-methyl transferase. This is a PNMT, phenylethanolamalane N-methyl transferase. This is an enzyme which is there into the adrenal medulla, which is responsible for conversion of norepinephrine into epinephrine. So it enhances epinephrine formation. It inhibits the the enzymes which breaks down the catecholamines. So it try to, what these two actions does, it try to increases the level of catecholamines, plus it sensitizes the arterioles to the constriction of catecholamines. So vascular reactivity becomes more in the presence of glucocorticoids. So thus help in maintaining normal blood pressure by restoring vascular reactivity. Therefore, in the absence of glucocorticoids, circulating catecholamines decrease and may produce vascular collapse. So why there is a vascular collapse in the absence of steroids is because no steroids, the reactive vascular reactivity to the catecholamine is not there. So there is a vasodilatation, capillary permeability increases, and so there is vascular collapse. Then next action is six, that is called permissive action. That's very important action, permissive action. Okay, you people must have noticed. Okay, Mm, we when people who has been having bronchial asthma, and in that nebulizer you take the medications in that nebulizer. You take the medication under pressure. In that nebulization, if you see, you check it. Okay, if you don't know, in that nebulizer, what is there? In that nebulizer, you have one sympathomimetic drug. Okay, salbutamol is there, plus one steroid is there, glucocorticoid is there. Okay, so what that steroid does? Steroid enhances the action of that sympathomimetic salbutamol for bronchial muscle. It relaxes or causes bronchodilation. So that is called permissive action. So small amount of glucocorticoid must be present for a number of metabolic reactions to occur. Okay, although they may not produce the reaction by themselves, this is called the permissive action. That is very important. So permissive action for glucagon and catecholamines to exert their calorigenic action to increase the heat inside the body, for catecholamines to increase their lipolytic effect by increasing, enhancing free fatty acid from adipose tissue, and glycogenolytic effect, breakdown of glycogen to glucose. Okay, that is for catecholamines, remember. And for catecholamines to produce pressure response and bronchodilation. So means, even though glucocorticoid does not do this action, their presence helps,
Ooh.
their presence helps the action of the other hormones to work better. That's called the permissive action. So on bone metabolism, what it does, it retards the development of cartilage and causes thinning of epiphyseal plate, which inhibits new bone formation. So glucocorticoids is their excess amount. So new bone formation is inhibited. Remember it. Then it breaks down the bone matrix due to protein catabolism. So it is known for protein catabolism. So bone matrix it breaks down, doesn't allow new bone form. So what will happen? Plus decreased deposition of calcium. Okay, increase excretion of calcium in the urine. Okay, decrease calcium absorption from GIT by inhibiting the action of 125 dihydroxycholecalciferol on the GIT. So all these eventually produce calcium को absorb नहीं होने दे रहा है, calcium को deposit नहीं होने दे रहा है, bone matrix को catabolize कर रहा है. Okay, development of cartilage can inhibit करता. All these actions ultimately leads to what? Osteoporosis, which results in skeletal deformity and collapse of the vertebrae, and there will be tetany due to decrease in serum calcium level. Okay, so all these things produce osteoporosis. So remember, excess glucocorticoids in elderly people, you have to be think. Okay, you have to be very much conscious, because sometimes patient on allergy, patient on chemotherapy, sometimes you require to give them prolonged doses of the steroids. In that you have to see it key. If you are giving the prolonged treatment, they have the actions on the bones, they make the bones very brittle. Okay, so that is on bone. Then on blood cells and lymphatic organs. On blood cells, what they do? Eosinopenia. What eosinopenia? What does? Decrease in eosinophil count. How? One is increased sequestration of eosinophil in the lungs and spleen. Means eosinophil gets squeezed into the lungs and spleen. So from circulation they get disappeared. Plus increased eosinophil destruction. Okay. And these changes in eosinophil level has been used an index of change in adrenocorticotropic hormone secretion. So if you want to judge adrenocorticotropic hormone secretion is secreting more or less, one way is that you see in the blood there is eosinopenia. You under the influence of ACTH, there is eosinopenia. That's one of the indicator. Plus lymphopenia, but their mechanism is different. Decrease in lymphocyte mitochondrial activity, obviously interfering with DNA synthesis. Increase lymphocyte destruction in circulation. Okay, so obviously then decrease lymph node size, lymphatic tissues, spleen and thymus, and obviously there all the size of lymphatic tissues is decreased. Primary and secondary lymphatic organs. Sorry, if these are secondary lymphatic organs, so there is a lymphopenia. Then there is a basopenia. Action is similar to that of eosinophil. Plus there is a neutrophilia. Means it causes increased release of the neutrophils from the bone marrow. Okay, so all these things, increased release, prevent neutrophil migration from vascular spaces to the tissue, doesn't allow them to go there. Okay, inability inhibits ability of neutrophil to adhere and marginate to the vessel. Obviously, it doesn't allow the neutrophils to attach to the vessel wall and to go outside it. So obviously, it leads to neutrophilia, increased neutrophil count. Then there is a polycythemia by stimulating orthopoiesis. Means if there is a steroids are there, RBC count increases, plus increase platelet count, decrease clotting time. Okay, so that's why chronic adrenal insufficiency leads to uh, moderate anemia. Means adrenal corticals stimulates the RBC formation. On CNS, excess of glucocorticoids decreases the threshold of electrical excitation of the brain. That is, stimulates activity of the brain excitability producing convulsions. See, it's enhances the electrical excitation of the brain. So electrical activity of the brain is enhanced. So it produces convulsions. So if you want to give glucocorticoids in a person with a epilepsy, you should be very much take precaution. So that's the reason why glucocorticoids are not given in epilepsy, as they decrease convulsive threshold. Conversely, mineralocorticoids have opposite effect on CNS. They decrease the threshold and therefore are given on the epileptic patients. So when you want to give the steroids, okay, for particular purpose, and person has epilepsy, then you have to judge whether you want its action on this water and salt conserving action, or for what purpose you want to give. In that case, mineralocorticoids is a better choice. It doesn't enhances the CNS electrical activity and it is a better choice. So in adrenocortical insufficiency, patients are hypersensitive to taste and smell. Remember this. Patients' taste and smell sensation are enhanced in adrenocortical insufficiency. Slowing of electricity of the brain causes slowing of alpha waves in ECG and personality changes. So in adrenocortical insufficiency, there is a personality changes like irritability, apprehension, okay, restlessness, insomnia, loss of concentration, and mental fatigue. So these changes you get it. You can hear me?
Yes.
Yes, sir.
Hello.
Uh,
Yes,
Yes,
sir.
on GIT. Okay, so on GIT, what is action? So this is I think there is something typing error. It increases the gastric acid and pepsin secretion. So steroid hormones, they increase the gastric acid and pepsin secretion, and so peptic ulcer formation becomes more because decreased gastric mucosal cell proliferation. On the contrary, increase acid secretion, so promote peptic ulcer formation. Okay, 1 minute. I have some phone. I will receive this. Hello. हाँ. नहीं आज नहीं, ट्यूसडे है ना, टुमारो. I will talk you afterward. नहीं आज नहीं है, मैंने एक टाइम टेबल पुट अप किया एक्चुअली 9:30 to 10:30 टुमारो है ना, ट्यूसडे है ना. Okay, I have taking class. I will you whatever you send me WhatsApp. Okay. Okay, can you hear me?
Yes.
Yeah.
yes,
So
sir.
on
Yes,
GIT,
sir.
it has action on enhances acid secretion, and there are chances of peptic ulcer formation if person is on steroid. Remember, steroid treatment, and then on fat that enhances the fatty fat absorption. Okay. Then resistance to stress. Okay, resistance to stress. So any stressful stimulus. Okay, any change in the environment that alters the optimal steady state in the body is called stress. So any stress, these hormones are get released. Okay. So what they do, glucocorticoids interact with catecholamines and cause activation of sympathoadrenal medullary system. So in stress, catecholamines also release. In stress, steroids also release. So there is something sympathoadrenal medullary system interacts. So what it does, glucocorticoids enhances the action of catecholamines to maintain vascular reactivity that we already said. Okay, for vascular reactivity, you require small amount of glucocorticoids. Plus, glucocorticoid necessary for the catecholamine to exert their full fatty acid mobilizing action, because in stress you require a lot of energy. So for that you require fatty acid mobilizing action. Okay, so that's why, because of its role in the mediation of long-term stress, steroids, glucocorticoids has been called body stress hormone. One of the, it is not sole, it is one of the stress hormone along with the catecholamines. Then it has the anti-inflammatory and anti-allergic action. And you must be knowing anti-inflammatory, anti-allergic action, for that they are meant. How they do, decrease local reaction. What? Local reaction of inflammation by decreasing hyperemia, exudation, migration of, you already seen migration of neutrophils and infiltration of leukocyte at the site of injury. They don't allow them to go there. Decreasing hyperemia, exudation, okay, preventing release of inflammatory mediators like kinins, inhibiting collagen synthesis, inhibiting phospholipase A2. So they decrease the local reaction. Then next, what they do, prevents tissue damage by stabilizing lysosomal membrane, thereby preventing escape of protease and hydrolyase enzymes into the tissue fluid. Okay, so they prevent tissue damage by stabilizing lysosomal membrane. So they don't allow the lysosome to break. If lysosome breaks, then the local inflammatory reaction may occur. So even they don't allow the lysosome to break. Then next, what they do, decrease the fibroblastic activity. Fibroblastic activity, if they decrease, then what will help? So which allows the spread of infection and delays wound healing. That is one thing. Okay, that will happen with the fibroblastic activity. So spread of infection and delays wound healing. Wound healing is a problem if there is a steroid treatment is there. Decreased production of ground substance by collagen producing cell. This prevents again tissue adhesion. Means reparative process or regenerative process getting hampered. Decreased release of endogenous pathogens from the granulocyte that decreases the fever. In late stages, there is a decreased antibody formation by its destructive effect on the fixed lymphoid tissue. Okay, so slows the degrading effect of collagenase on joint tissue, and this is a useful action. It slows the degrading effect of collagenase on joint tissue in rheumatoid arthritis. This is why steroids are injected intractally in arthritis. तो जिनको joint का दर्द होता है, उनका जो collagenase की action है, उसकी action को slow करता है actually. So joint destruction process becomes slower. तो ये इसकी एक therapeutic action है. That's why steroid has been injected intra-articularly जिसके joint में दर्द है actually. Plus reduces histamine-induced features of allergy or hypersensitivity response to antigen-antibody reaction by inhibiting the release of histamine. Means it histamine induced features of allergy decreases by inhibiting the release of histamine. Just inhibiting the release doesn't do synthesis of histamine, doesn't inhibit the synthesis of histamine. So glucocorticoid don't affect the combination of antigen with the antibody. Okay, जिसकी combination होगी उसको कुछ नहीं करेगा. And have no influence on the effect of histamine once it is released. Histamine एक बार release होगा तो कोई action नहीं है उसकी, but it inhibits the intracellular synthesis of the histamine. That it does. Other actions very important. During fetal life, glucocorticoid increases maturation of surfactant in the lungs along with the insulin. Remember, for the maturation of lung surfactant, steroids are very vital along with the insulin. So जिसके lung surfactant mature नहीं है, उसको after postnatal they give the steroid treatment. So in large doses, glucocorticoids inhibit the growth by decreasing growth hormone and thyroid stimulating hormone secretion. For the growth, you require growth hormone, and for the maturation of the bone, you require thyroid stimulating hormone. So अगर large doses में आप देते हो infants को, तो ये उनकी growth को inhibit कर सकता है. ये उसका एक disadvantage है. And obviously, glucocorticoid inhibits the secretion of adrenocorticotropic hormone. Adrenocorticotropic hormone stimulates adrenal cortex to produce steroids. अगर ग्लूकोकॉर्टिकॉइड्स का लेवल बढ़ गया तो ऑटोमेटिकली एसीटीएच का लेवल कम होगा. That's the thing. Okay. So now this is the action of glucocorticoids. Now, if glucocorticoids has been produced in the excess amount, okay, in excess amount, so what will happen? That condition is called Cushing's syndrome. Okay, Cushing syndrome happens if the body has been exposed to a sustained high level of glucocorticoids. Cause क्या हो सकता है? Cause I will tell you roughly. There might be a adrenal gland tumor, adrenal cortical tumor. जो cortical tumor है, जो glucocorticoids excess secrete कर रहा है. One thing. तो ये क्या होगा? Independent of ACTH होगा. ACTH stimulate नहीं कर रहा है. Adrenal cortex का cortex में tumor है तो automatically glucocorticoid ज्यादा बन रहा है. दूसरा क्या हो सकता है कि एंटीरियर पिट्यूटरी ट्यूमर होगा. एंटीरियर पिट्यूटरी ट्यूमर होगा तो क्या होगा? एसीटीएच ज्यादा बन जाएगा. एसीटीएच ज्यादा बन जाएगा तो ज्यादा कॉर्टेक्स को स्टिमुलेट करेगा, तो ज्यादा एड्रेनोकॉर्टिकोट्रोपिक हार्मोन सीक्रेट होगा. और तीसरा क्या हो सकता है? ये दोनों कुछ भी नहीं है. जो पर्सन है वो ओरली मींस एक्सटर्नली दे आर टेकिंग एक्सोजीनस इंजेक्शन ऑफ मोर स्टेरॉइड्स ले रहा है. कुछ उसकी ट्रीटमेंट चल रही है, कीमोथेरेपी चल रही है या कुछ ट्रीटमेंट चल रही है उसकी वजह से उसको ज्यादा स्टेरॉइड्स ले रहा है, या और उसकी वजह से स्टेरॉइड्स बॉडी में जा रही है. दीज आर द थ्री रीजंस व्हाई पर्सन माइट डेवलप द excess exposure of steroids. So causes भी है independent of ACTH. ACTH का कोई रोल नहीं है. तो क्या हो सकता है? एक तो प्रोलॉन्ग ट्रीटमेंट विद हाई डोसेज ऑफ ग्लूकोकॉर्टिकॉइड्स, ये हो गया. सेकंड है एड्रेनल कॉर्टिकल ट्यूमर, जस्ट आई टोल्ड यू. ट्यूमर है उसमें एसीटीएच का कोई रोल नहीं, तो ऑब्वियसली स्टेरॉइड बन रहा है. एसीटीएच डिपेंडेंट है. कब होगा? एक ट्यूमर होगा. कौन सा ट्यूमर होगा? पिट्यूटरी ट्यूमर होगा, वन थिंग. और इक्टोपिक एसीटीएच प्रोडक्शन बाय नॉन पिट्यूटरी ट्यूमर्स लाइक कैंसर ऑफ द लंग. इट हैज बीन फाउंड दैट कि कुछ कैंसर ऑफ द लंग्स होते हैं तो वो क्या करते हैं? एसीटीएच प्रोड्यूस करते हैं. एसीटीएच तो प्रोड्यूस होता है नॉर्मली एंटी पिट्यूटरी से, बट ये नॉन पिट्यूटरी ट्यूमर्स होंगे तो वो एसीटीएच प्रोड्यूस करे. तो एसीटीएच प्रोड्यूस होगा तो क्या करेगा? स्टिमुलेट कॉर्टेक्स को करेगा. ऑब्वियसली स्टेरॉइड्स ज्यादा बनेंगे. फीचर्स क्या आएंगे, जो उसके जो whatever was even the physiological things, the physiology becomes now extreme. प्रोटीन मेटाबॉलिज्म, ये क्या करता है, प्रोटीन कैटाबॉलिज्म में, तो ऑब्वियसली निगेटिव नाइट्रोजन बैलेंस एंड रिटार्डेशन ऑफ ग्रोथ, क्योंकि प्रोटीन को ब्रेक डाउन कर रहा है तो ग्रोथ रिटार्ड हो जाए, तो स्किन बिकम थिन, ओके, पेपर लाइक एंड ट्रांसपेरेंट, थी स्किन बिकम वेरी थिन, मसल्स टू गेट वेस्टेड एंड पोरली डेवलप, सो मायोपैथी डेवलप होगी, स्टेरॉइड मायोपैथी, एंड दिस अलोंग विद एसोसिएटेड हाइपोकैलेमिया, क्योंकि ग्लूकोकॉर्टिकॉइड्स क्या करता है, सोडियम रिटेन करता है, पोटेशियम एक्सक्रीट करता है, तो हाइपोकैलेमिया होगा तो मार्क मस्कुलर वीकनेस होगा, देन we are saying that decreased fibroblastic activity, poor wound healing, and minor injuries to produce bruises and ecchymosis, which get aggravated by precipitation of diabetes mellitus and decreased fibroblastic activity. Obviously, I told you that these glucocorticoid steroids are diabetogenic hormones. So, जिसको diabetes है, उसका diabetes precipitate हो जाएगा ये. Hair to become thin and rough, resulting loss of scalp hair. Hair भी एक प्रोटीन ही होता है, तो scalp hair lose हो जाएंगे. Reduction in lymphoid tissue and dissolution of lymphocyte, which increase the uric acid excretion in the urine, and breakdown of muscle, which increase creatine excretion. So uric acid excretion होगा, creatine excretion बढ़ जाएगा urine में. You can hear me?
Yes, sir.
Yeah.
Yes,
Yes,
sir.
sir.
So carbohydrate metabolism क्या होगा? Excess sugar बढ़ा
Yes,
देगा.
sir.
तो बॉडी में क्या होगा? हाइपरग्लाइसेमिया होगा. हाइपरग्लाइसेमिया होगा तो ऑब्वियसली ग्लाइकोसूरिया भी होगा. तो इंसुलिन का रेजिस्टेंस बढ़ जाएगा. Liver glycogen बढ़ जाएगा. So all these what they do, they precipitate insulin resistant diabetes mellitus, especially in patient genetically predisposed to diabetes called steroid adrenal diabetes. So ये diabetes को बढ़ा देगा, जिसका diabetes नहीं वो diabetes के कगार पे चला जाएगा actually. Plus hyperlipidemia and ketosis, free fatty acid level ज्यादा बढ़ जाएगा, उनका breakdown ज्यादा होगा, तो ketosis हो जाएगा, ketosis condition होगा, तो pH become acidic, ketosis होगा तो acidic pH हो जाएगा. Fat metabolism, it causes redistribution of fat at the expense of fat in the extremities, called centripetal distribution of fat. Body का fat का redistribution, it glucocorticoid does. Redistribution means जो भी fat extremities है, extremities का fat को utilize कर लेगा वो, and fat deposition होगा central part of the body, like abdomen, chest. Okay, so extremities are thin. Deposition of fat over the abdomen leads to pendular abdomen. Abdomen की size बढ़ जाएगी. Plus जब abdomen में fat ज्यादा बढ़ जाएगा तो what happens? Rupture of the thin skin happens. Stretching होगा तो rupture होगी. And what you find there is a reddish purple stria. You get the stria. Like pregnant lady, you see the stria. So person with this, you get the stria. Plus face becomes moon-like with narrow eye slit and fish-like mouth. Okay, that the face characteristic feature of the face in Cushing's. Fat deposited in the upper back में कहाँ, in between the below in the nape of the neck, तो क्या होगा, buffalo hump बन जाएगा एक, buffalo में जो hump होता है, that the buffalo hump. Then increased fatty acid level, blood lipids and cholesterol level, it leads to atherosclerosis. Electrolyte and water metabolism and vascular reactivity, there is edema and hypertension. Bone metabolism, osteoporosis, it becomes osteoporosis plus precipitate, because calcium excretion बढ़ा देगा, blood calcium decrease होगा तो tetany form हो जाएगा, है ना. Then there is in the blood eosinopenia, lymphopenia, basophilia, and neutrophilia. There is a polycythemia, increase in platelet count and decrease in clotting time. Obviously, that are the blood features. In CNS, you find this frank psychosis, euphoria, restlessness, excitability, because hyperexcitability of the neurons. There is excitability and restlessness. And plus, there is psychosis and euphoria. GIT predisposed to peptic ulcer formation. It has the एंटी-इन्फ्लेमेटरी एक्शन, बट एंटी-इन्फ्लेमेटरी एक्शन की यूज तभी होती है जो लिमिट में काम करे. When it crosses that limit, it becomes what? Person becomes susceptible to infection, है ना, क्योंकि आपकी इम्यून सिस्टम को सप्रेस करके रखेगा तो ऑब्वियसली इन्फेक्शन चांस ज्यादा बढ़ जाएगा. In sexual changes, what will happen? It increases the facial hair, hirsutism in girls, and acne due to increased secretion of adrenal androgens. One thing, impotency and hypogonadism in male and anemia in female. So ये दो चीजें, impotency in male and female दोनों में करेगा ये Cushing's में. Okay, इसकी एक better slide है. Cushing's, because it got the name from the Harvey Cushing, is the person who has described this. That's why it's called Cushing syndrome. What you get it? See, you get the personality changes. There is irritability, euphoria. Okay, face becomes moon face. Increased susceptibility to infection. In males, there is a gynecomastia. Okay, because estrogen levels become more. I told you, adrenal androgens, estrone, estradiol, they are formed. So gynecomastia in males. Fat deposit on the face and back of the shoulder. Okay. Then there is osteoporosis. Bone becomes brittle. Hyperglycemia, CNS irritability, sodium and fluid retention that leads to edema. Extremities become thin. Gastrointestinal disturbances. In female, you find amenorrhea and hirsutism. And skin becomes very thin, paper-like. You see purplish striae over the skin. There are bruises and patches because they are become very thin. Okay, in ladies you find there is red cheek, there's acne, thinning of hair, face becomes moon. Okay, buffalo hump, just back, extra fat around the neck, thin skin, easy bruising. There is a weight gain, obviously weight gain but jagah. Red stretch marks over the abdomen. Abdomen becomes splendora, thin arms and legs, and there is a weak bones. Okay, wound becomes there is slow wound healing. Swelling of the legs and feet, and this is how the moon phase appears. The whole face is swollen. So that's the features of Cushing syndrome. So Cushing syndrome, you not only get with excess glucocorticoids, that might be because of the exogenous ingestion. Also, if you do it, the chances of you Cushing syndrome, you might get it. Okay, so with this, today we stop with glucocorticoids and Cushing's. Okay. The next lecture we do with mineralocorticoids and the Addison's disease. Okay.
Yes.
Okay, sir.
Yes, sir.
Okay, sir.
Okay, sir.
Okay. We put these notes on the
Yes, sir.
WhatsApp group. Okay. So you can have these notes on the WhatsApp. So there's no problem. So whatever questions you can ask in the WhatsApp group.
Yes, sir.
Yes, sir.
Okay,
Yes,
sir.
sir. Yes, sir.
Okay,
Okay then.
sir.
Okay.
Okay.
Yes.